I'm going to move in and talk about something a little bit different. It's similar. It's a kind of a way to assist the patient's breathing before they're really in respiratory failure, and that's this thing we call CPAP or BiPAP. They're actually two different things, but we actually do tend to use them interchangeably. So CPAP stands for continuous positive airway pressure. And it's not really ventilation. I don't know who made these slides. So continuous positive airway pressure, CPAP. And BiPAP is bi-level positive airway pressure, so BiPAP. So here's what it is. You may have heard of this before in reference to patients with sleep apnea. It's a mask that they wear, and what it does is it blows a bunch of air into their lungs at a particular pressure. And it maintains a constant back pressure, which prevents those tiny little alveoli from collapsing. So alveoli can actually collapse. So let me draw my little alveoli here. So my little alveoli is there. And inside the alveoli is this special little substance called surfactant. And the surfactant helps keep the airways open. But if they get gunky, or really actually it happens in every single one of us all the time, sometimes these little alveoli just kind of stick together. So instead of being nice and open like that, they're kind of just pancaked and collapsed and stuck together. And air can't get in and can't get out, so no gas exchange happens. This alveoli is basically useless. What happens with the CPAP is that the air comes into this little collapsed alveoli and it puts pressure on it so that it keeps that balloon inflated. And it's just a little bit of pressure. It's not really a lot at all. It's enough, though, that it helps pop all of those alveoli open. I'm going to give you a kind of a vocabulary word here, and that is called atelectasis. 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 I think it isn't either. I'll look it up. Atelectasis. That's a fancy term for collapsed alveoli. Atelectasis. So you'll probably hear me use that word. But atelectasis, or the collapsed alveoli, and CPAP or BiPAP are going to fix this atelectasis. As an aside, I mentioned that we always, every single one of us has some collapsed alveoli. Atelectasis is actually just part of our daily lives. All of us have some level of atelectasis. Things that we do to fix that: if you sigh, you take that big deep breath and it helps pop those alveoli back open. When we yawn, we actually are doing a little bit of our own CPAP, because you're actually kind of pushing back in your lungs and helping pop those alveoli back open. CPAP and BiPAP are just mechanical ways of doing that. We call it a splint for your airway. It splints your airway open by increasing the pressure in your lungs. This helps increase gas exchange and ultimately reduces the work of breathing. So if somebody is working really hard to breathe, but they're still able to breathe okay, we can try giving them CPAP. So here's your setup. This is a mask. This is a little CPAP device. There's a little oxygen reservoir here to help get more oxygen in. And this is the strap that goes around the mask and it goes around the head to help keep a seal. Because you still have to have a good seal with this, just like with all the other masks. The indications for this are acute respiratory insufficiency. So they're breathing, but they're not breathing well enough. And moderate to severe distress, although I'm going to say it's more moderate distress. If they're getting to the point of severe distress, you really need to think BVM. Contraindications are unable to protect their airway, altered mental status, and facial trauma. The other thing is respiratory failure, which we're going to define a little bit later, but respiratory failure is a contraindication. Respiratory failure means that it doesn't matter how hard they're working, they're not able to exchange oxygen and carbon dioxide. They can't get oxygen in. So respiratory failure is a contraindication because they need a BVM instead. So what do we do? Well, you can see here's your patient. He's got this big old mask on. He's sitting up so he's comfortable. You're going to set the liters per minute, although usually this is going to be high or wide open. So adjust your liters per minute on your oxygen tank. Set the pressure, and remember centimeters of water, H2O is water. Centimeters of water is a pressure measurement, so you're going to set the pressure. And this is going to vary how you do it with each device. The way you do it on this one, I think, is actually this thing right here. Position the patient sitting up, 45 degrees or higher. And then you have to talk to your patient, and this is key. These patients are already usually a little bit hypoxic, and the first thing that happens when you get hypoxic is you get anxious. You get really anxious. And now you're going to take and try and shove a noisy mask in this person's face, because this is not a quiet procedure. This is loud. It's a loud procedure. So communicating with your patient is really important here. Talk to them. Let them feel the air blow in their face. Help them get them to help hold the mask in place. Then you're going to position the mask. Secure the mask once you get a good seal. And it could be that the patient ends up holding a good seal all the way to the hospital. It may be that that's what's needed. So you use the straps to secure the mask if you get there, and then reassess your patient. I will say it's useful to always at least try and secure the mask. But this can be a tricky procedure just because of the patient's anxiety level. Generally speaking though, once you can talk them into wearing this mask on their face, they tend to do pretty well. They get used to it pretty quickly, and it helps them really fast.